Should I worry about my pap smear results for cervical cancer? Getting your pap smear results can feel nerve-wracking, but it's important to understand what they really mean. A pap smear is a screening test that looks at cervical cells to find early signs of changes that could lead to cervical cancer. It's a vital part of preventive health care, helping catch problems before symptoms appear. But not every abnormal result means you have cancer. Many changes are mild or temporary and can be managed effectively. When your results come back normal, it means no abnormal cells were found, and you can continue with routine screening as recommended. If your results are abnormal, it doesn't automatically mean cancer. Abnormalities can range from mild changes, like atypical squamous cells of undetermined significance, to more serious precancerous conditions called cervical intraepithelial neoplasia. Most mild abnormalities tend to resolve on their own or with simple treatment, especially if caught early. Sometimes, your test might show you have high-risk types of human papillomavirus, or HPV, which is a common virus linked to cervical cancer. A positive HPV test means you might need closer follow-up, such as additional testing or a colposcopy, which is a detailed exam of the cervix. Detecting precancerous lesions early allows for effective treatment, preventing progression to cancer. It's important to remember that actual cervical cancer detected through screening is rare, especially when regular screening is followed. So, should you worry? Not necessarily. An abnormal pap smear is often a sign that further investigation is needed, not an immediate diagnosis of cancer. Many abnormalities are manageable and can be treated successfully. Following your doctor's advice for follow-up testing is crucial. This might include repeat pap smears, HPV testing, or a colposcopy. These steps help clarify what the abnormal result means for you personally. Screening guidelines recommend starting at age 21 and continuing until about age 65. Women aged 21 to 29 are usually advised to have a pap test every 3 years. From age 30 to 65, screening can be done every 5 years with HPV testing alone or combined with pap testing, or every 3 years with pap testing alone. If you've had a hysterectomy with removal of the cervix and no history of precancerous changes, you might not need screening anymore. Always discuss your individual situation with your healthcare provider, especially if you have symptoms like abnormal bleeding, pelvic pain, or unusual discharge. The key is to stay informed and follow your doctor's recommendations. Regular screening saves lives by catching changes early when they are most treatable. Remember, an abnormal result does not mean you have cancer, but it does mean you should follow up to understand what's happening. If you're worried or have questions, talking openly with your healthcare provider is the best way to get personalized advice and peace of mind. Staying proactive about your reproductive health is the best way to ensure your well-being and catch any issues early.